Are we back?
Yes, sir. Please start.
Very good morning. Very good morning to respected seniors and dear colleagues. It's my great privilege to welcome to our 11th session of the PATH Pediatric Action for Teenagers Health. This is the session we have conducted with the help of Maharashtra Academy of Indian Pediatrics, with the help of our President, Dr. Ramakant Patil sir, and Adolescent Health Academy Chapter, Nasik branch, with the help of Suchita ma'am. And all sessions very well guided by our own Dr. Atul sir. Yes, sir.
नहीं, मॅडम अमोल पवार सर यातले मेन आहेत.
Yes, sir, बोलते हैं ना. I'm coming with the secretary. And definitely all the program is very well coordinated by our own Maharashtra Secretary, Dr. Amol Pawar sir. It's our consecutive 11th session that we used to always conducting since last 11th month on every first Sunday with a different topic and a very well-known speakers. Today, we have with us our President-elect, Dr. Vasant Kalatkar sir. Welcome to you, sir, and very great congratulations on your huge victory.
Thank you.
Maharashtra IIP is very proud of you, and we all are always with you, sir. Today we have our speaker, Dr. Swati Bhave ma'am. The name itself suggests a great work in Adolescent Health Academy and also for all the pediatricians. I welcome our chairperson of Nasik AHA, Dr. Suchita ma'am. Ma'am will have few words. After that, Dr. Amol sir will welcome Vasant sir, Dr. Vasant sir. Over to you, ma'am.
Suchita madam,
left झाल्या बहुधा. त्या just left झाल्या. Over to Dr. Amol sir to welcome Dr. Vasant sir.
Thank you, Reena. Today we have a great pleasure to welcome Dr. Swati Bhave ma'am, who is a Dian in adolescent medicine, and she has worked very hard as a president of National IIP in year 2020, and at national international level also she is known for her work in adolescent medicine. So I welcome respected Professor Dr. Swati Bhave ma'am. I also welcome President-elect 2024, Dr. Vasant Kalatkar sir. He is the future of Maharashtra IIP and National IIP also. We all know he has won with a huge margin of nearly 2,000 votes in recently held elections of IIP. Dr. Vasant Kalatkar sir was chairperson of neurology chapter in year 2022, and he is currently chairperson of ID chapter of National IIP. He is from Nagpur, and he's a director at Colors Children Hospital at Nagpur also. So I welcome Dr. Vasant Kalatkar sir and ask him to have few words of blessings to Maharashtra IIP and AHA Nasik for this program. Over to you, Vasant sir.
Good morning, everyone. Am I audible? Yeah. Good morning, everyone. Respected Swati madam, Atul, dear Atul, Dr. Sushmita, Dr. Reena, Dr. Amol, all Nasik IIP member, adult group member, and all from Maharashtra and all delegates. The greetings from Central IIP. As a President-elect Central IIP, I welcome you all for this lovely talk and very nice first Sunday of the December. Though it's end of the year, but I know this is a very good beginning of December, and we are all doing for adolescents. This year, there are so many branches, but I saw the branch of Nasik, active branch in adolescents academy. And that's why they could pay the bid for AdolesCon this year. And recently I had a talk with Dr. Sharma, secretary of the chapter, secretary of the national chapter, and he had a very high word about Nashik and why people have got the. I am definitely confident that Adolescence will be a memorable adolescence. Definitely.
ती सांगते ना कसं रक्त कमी करायचं व्यायाम करायचं.
Chavan,
We ask people to
Chavan,
mute.
unmute करा.
Sorry, sir, for the disturbance. Pallavi, please mute everyone except for the
Yeah.
sir.
So
Yes, ma'am. Yes, ma'am.
everybody know about the Swati madam. I am listening her since my inception in IIP, because you can see माझे एखादा आदर्श असतो ना, तसं 92 ला मी खरं म्हणजे ऍक्टिव्ह प्रॅक्टिस मध्ये आलो. 91 मध्ये होतो. 92 देर वॉज अ कॉन्फरन्स इन नागपूर, दॅट इज अ पेडिकॉन. त्यामध्ये स्वाती मॅडमला मी खूप असं ओळखायचो नाही, पण स्वाती मॅडमला जे पाहिलं, शी वॉज सेक्रेटरी. मॅडम, आय एम राईट? यू
Academic affairs.
अकॅडमिक अफेअर्स. आणि मॅडमची जी झिंक होती, मॅडमचं सगळं कनेक्ट होतं, सगळ्यांना भेटायचं, त्यातनं मी बरंच काही शिकलो. म्हणजे त्याचं एक म्हणतात ना, इन्स्पिरेशन असतं तसं, लाईक मेंटर फॉर ऑल दॅट, की माणसाने कसं पुढे जायला पाहिजे, कसं काय, नॉट ओनली दॅट. मग मॅडमनी मला सांगितलं, वसंत, तू एकदा खूप अगदी सगळं एव्हरीथिंग सोशल अँड एव्हरी ऑल आस्पेक्ट मध्ये खूप चांगलं आहेस तू. नाऊ यू हॅव टू गो आफ्टर अकॅडमिक्स. अँड सिन्स लास्ट 15 years, काय इनिशियल days of practice, I couldn't do much in academic, only except my lecturership in medical college. But once madam said की वसंत तुला तिकडे जायला पाहिजे, then I started, because this was a कानपिचकी म्हणतात ना, तशी मॅडमने घेतलेली कानपिचकी होती ती. आणि that's why I could reach to this place, not only because of me, but त्या या अशा कानपिचक्या सिनियर लोकांच्या आणि and all love affection of you people. That's why I could achieve this grand position. So everything, there is no need to tell about Swati madam. मला वाटतं एवढं सांगितलेलं भरपूर आहे. आणि you are going to listen, and Nasik IIP, that path, really it's helpful, and it should be now not limited to Nasik or Maharashtra. It should be our national program. I know Dr. Kanikar is there, Amol is there, and DC Adoskan is there. Swati madam, you had to guide us ki how to go through national and all the government agencies. How can we use about the public-private partnership so that we can do something for the community? See, there are very few programs, those who are for the community, and this program is one of the program which we can go for community, and that's definitely it's our duty. We on paper say कि our duty is to serve the community and socialism, but unfortunately it never happened. So now Open Ray is having a very good program, Triple S. We will continue that program also. But madam, we, along with all this team of Maharashtra, we need your help how to reach government, and through IIP we can conduct this program.
Again, to work with you. तुला माहितीये ना, सर्वात हॅपीनेस टीचरला कुठला मिळतो, की आपला शिष्य आपल्यापेक्षा सवाई झाला. तर तुमच्यासारखे सगळे शिष्य असे सवाई झाल्याने मला जो काही आनंद आहे,
चान्सच नाहीये.
मॅडम, मला सवाई कुठेच व्हायचं नाही, फक्त सगळ्यांचं सगळं छान छान करायचं. IIP चांगलं IIP खूप काम करायचं. दॅट्स ऑल. थँक्यू मॅडम. थँक्यू ऑल फॉर इन्व्हायटिंग मी ऑन दिस प्लॅटफॉर्म. आय थिंक दिस इज माय फर्स्ट program on this platform. Thank you once again, and I wish all the best to Nasik IIP and Maha IIP.
सर थांबा बरं का, पण अजून जाऊ नका.
नाही जाते सर. नाही जाते. आज रविवार आहे सर, रविवार आहे.
ओके, ठीक आहे.
Thank you very much, sir, for your valuable words. It's always great to listen to seniors and follow on their footsteps. Thank you very much, sir. Now I invite Dr. Atul sir to introduce our speaker, Swati Bhave ma'am. Over to you, sir.
Arey madam, just now there are so many non-Maharashtrians, so let us continue in Hindi or English maybe. But आताच just now Vasant Kalatkar sir said की madam बद्दल काही सांगायला नको. There is no need to introduce her. But I still dare to say some few words. Kalatkar sir, if you allow. Okay.
Yes sir.
So, yes sir. Yeah, please. So basically I know madam for last maybe 23 years or so, since we had ICPA at New Delhi, and then we had so many modules, AFSI, AFHS, difficult adolescent, WHO program, so many things we had together. And one thing I really appreciated about Madam Bhave was she is a great academician, no doubt about that. She's an excellent orator, but more than that, she's a good listener. And when you are, when you are into adolescent practice, you need to listen to children more than talk about. So basically, whenever we had any issues at hand, what program should be made, she was always all ears. When people like me, juniors like me, were trying to tell her, convince her something, and she was absolutely accepting everything that she found correct, if I'm not wrong. There was hardly any conflict between us, but whenever there was, she has so many life skills. She is an icon of life skills, I would say. If I want to become Swati Bhave Madam next Janam mein, so I have to learn so many life skills myself. So, Madam is very eager to come to Nasik in, I think, February, Madam?
Yeah.
Yeah. So, Nasik AHA will have a good program. And if any one of you is interested to visit Nasik on 9th, that is next Saturday, coming Saturday, I would invite all of you, especially Madam Bhave and Karatkar sir. We have a big, as sir said, Karatkar sir said, we should reach out to communities. So we have a big peer education program in Nasik on 9th Saturday. And then I invite you all on this platform to join us if you can. It's morning 11 to 2 o'clock program. And I'm very glad that, there was hardly a session by Dr. Swati Bhave Madam which we didn't learn anything from. Madam Barobar, if you spend, say, half an hour with Madam, you come out like कलाईचं भांड, सगळं तुमचं, all your dirt is gone and you come out all sparkling with all new ideas, and she is very good at it. And she was in Nasik for maybe a year or two when Yashwant Bhave sir was the collector of Nasik. And then she is from Vijay Medical College, which I also belong to as a very junior person. But she's an excellent academician, a very good editor, very good, she has some innovative ideas. I have been in all the programs which were designed by Bhave Madam, except that women's wing, which I cannot be. So, thank you, Madam, for, we have been waiting for you for my events, every first Sunday events of Maha-IP. And all this is the idea of our beloved Ramakant Patil sir and Amol Pawar sir. Amol Pawar sir has been working, slogging himself for this particular success. But, as Karatkar sir said, and I actually had a talk with Madam also yesterday, that let this not be the end of our Maha-IP session. Okay? So, if Karatkar sir permits and our new Maha-IP president permits, there's so many topics, so many issues. Every day we are having new issues. So, I think we should continue, because right now this is the highest participants number that we have on the screen. 87, I am reading this, and I don't know how many on YouTube. So, when you have stalwarts, you have speakers, we have doyens in the field of adolescent care. Sky is the limit. We can go on and on and on. So, Madam, what do you think? Should we continue this?
Yeah, actually, a very good idea. And I think, like, I purposely chose case scenarios instead of a lecture, because I thought like senior people, if we share our case experiences, that would be
Experience.
better than a lecture.
Yeah, absolutely. I do agree with madam, and we have been trying to make it practically possible for a practicing pediatrician. We have been told you look after children up to 18 years, but we are not empowered in our skills and in our knowledge. So I think this is a very good platform where people can learn and percolate whatever information we have, and we can update periodically. So I suggest that the new team also should encourage us. If not, then we'll continue on our own platform, as madam said. So this is in short what I know about Swati Bhabhe madam. She is very active in IIP. She's very active in AHA and international platforms, WHO and whatnot. So
Yes, sir.
madam,
Thank you very much, sir. Sir
Yeah.
has rightly said, there is so many things to learn from Dr. Swati Bhabhe ma'am. So let's collect few drops from that.
we are not able to hear you, Reena madam.
Yeah. Video off कर तुझा. Video off कर Reena तुझा.
Ocean of wisdom.
Okay, just say what you want to say.
No, let's start with ma'am's talk that I want to say.
Okay.
Wait. Dr. Ramakant Patil sir is there. Ramakant Patil sir, please have words with us. Your blessings. RD sir.
अरे वाह नहीं अनम्यूट कर
We'll continue the lecture. Swati ma'am,
Okay.
Swati ma'am.
Okay, just say
रमाकांत सर आता
this.
try करा.
Just say
रमाकांत
this.
सर आता try करा.
Yeah, thank
Yes,
you,
yes.
Pallavi.
Yes.
I was not allowed
हो
to
सर, हो
unmute.
सर. Yes, sir, yes, sir. आता you
It is
can.
great. Yeah, it is great pleasure to have the who's who of adolescent and AHA Academy on this forum, and I am really thankful to Dr. Atul Kanikar, under whose able guidance we had this wonderful journey of path in for last 11 months, and we have covered nearly most of the topics in, even if not it is exhaustive, but most of the topics, and he was ably supported by the Nashik AHA, by Dr. Chandrakant Survase, Dr. Reena Rathi, Dr. Sulabha Pawar, Dr. Sucheta Malvatkar, Dr. And other members like our
Sangeeta Bafna.
Uzaramkar, and so it had been a great journey, and as Dr. Amol Pawar is again secretary for 2 years, and Ram Gopal is going to be incoming president, and we are sure that this journey will be continuing in next year and another year also. So with this, I again express my gratitude to this AHA team under able guidance of Atul Kanikar for giving a wonderful insight for all the pediatricians across Maharashtra under the banner of Maha. Over to you, Atul.
Thank you. Madam, Reena madam, are you there? Okay. I think we start with Madam Bhave's lecture. We have 1 hour, madam, for you. Is that okay?
Yeah, more than enough.
Please share your screen. She has a lot of wonderful cases, and she has so many cases up her sleeves which she is not sharing with us today, but she is going to present her presentation.
Can you all see my screen?
Your voice is breaking, madam.
One. Now is my voice okay?
Voice is still not very clear, but
What I will do, I can go to my. Is my voice okay for others?
now this
No,
is
no,
okay.
Your
Now
voice
this
is okay for me, ma'am.
This
Your
is
voice
okay.
is okay.
This is okay. Yeah.
Okay. So
Please
first
continue.
of all, it's a great honor to be on this platform of Maha IIP. Can you hear me? Can you hear me well?
Yes, yes, ma'am. Absolutely, yes.
And every branch of IIP is dear to my heart, being the past president. But when you're staying in a state, you have a special connection with your state branch. And that's why it's a great honor to be called by Maha IAP for this program. And since I've stayed in Nasik for 2 years, Nasik is also very close to my heart. And they say ki Sone pe Suhaga, and to have as the guest of honor, Dr. Vasant Kalatkar is really a great honor to me. I'm really very happy about it. And I thank Ramakant, Amol, Deena, Atul, all are doing this program. So just people wanted to know what inspired me into adolescent health. And everybody knows ki 2000, I started the year of adolescent health. But my journey started much before. That is in 1984. When I was associate professor at Grand Medical College, our boss had interest in adolescents. And I was working as a pulmonologist and lot of research on asthma. And we did a project on 40 national level adolescent for cardiovascular fitness. And so in 1984 Pedicon in Mumbai, these were the papers I presented. These are my first adolescent papers published. They were later published in 85 to 89. And during this time, we came in contact with the parents of these 40 state level athletes. And I was a mother of 2 children, 6 months and 5.5 months. And so this adolescent parenting was like a wonderland for me. And when I realized the problems which these competitive adolescents are going, and the amount of what happened, and the amount, yeah, anything we wanted to say? And the guidance which these parents required, this fascinated me. And so adolescence and adolescent parenting has been my passion for so many years. And in 86 Delhi Pedicon, I presented my first paper on adolescent parenting. Now, those of you who are working with adolescent health, you know that we have a special history-taking form, which is known as HEADS assessment. And I'm not going to go into details because most people are first trained into HEADS assessment. Initially, when you start, it takes 45 minutes, but then you soon come to 10 to 20 minutes as you become more senior and more practiced. So managing adolescents and parents, a lot of it is, of course, counseling. And the classical counseling, as you know, is not telling the client what to do, but to help him or her to reach his own plan of action, where you're a facilitator. This takes minimum 45 minutes to 1 hour a session, and many sessions are required. So I would advise those who are into adolescent practice, don't take counseling lightly. I have seen many untrained counseling done, which does more harm than good. So please get training on counseling. We have done a lot of training through AHA. They are online courses because counseling is an art. Now I normally see referred cases, and I have a team who does this 45 minutes of counseling. And I do what is known as prescriptive counseling, in addition to counseling, preventive and anticipatory guidance. And if I feel a client requires prolonged counseling or CBT, REBT, I've got clinical psychologists and counselors on the team. Now, what factors lead to successful management? Parents willing to accept that they also need to modify their parenting pattern, and not just the adolescent whom they have brought to us as a difficult or problem adolescent. Some refuse to say that we are perfect. So don't try to tell us what to do, ma'am. Manage our child. And this becomes a very difficult situation because all of us know nature versus nurture. And a lot of adolescent problems are due to the parenting styles, the environment he faces at home, in the community, and in the school. So if the parents are not willing to change their behavioral pattern, we are not going to get a successful rate. Second, we need an adolescent who's motivated for change. And if you can build a rapport with the adolescent should start enjoying sessions with you, look forward to being with you. If he's forced to come by parents, then you are perceived as an enemy or an adult being on the parent side. And most important, parents to accept confidentiality, especially below 18 years. And we get a lot of adolescents when they have a confidentially with us, they say that, ma'am, our parents are given a strict warning not to reveal family secrets not to speak bad things about the family. And you can understand that if you really don't know what's happening in their family, especially a dysfunctional family, you are not going to help that child. I also get parents who come with romantic relationships and who say, ma'am, amcha mulga or our son is into a wrong relationship. So we have brought him so that you take him out of this relationship. Now, certainly this is not our job. So I tell them that I am going to assess whether this relationship is harmful to your child. Is it a toxic relationship? And I'll help him to come out if it is that. But if it's a healthy relationship, I'm not the parent to decide whether this relationship should continue or not. Because then I immediately get phones. Ma'am, what did he tell? Is he still seeing the girlfriend? Ma'am, what does the girlfriend think? So we have to be very careful about these things. So now I've divided my case scenarios into some illustrative sections. Like we all know, as I've discussed, parental modeling, positive and negative, has a tremendous impact on the behavior of the child or adolescent. And many of the so-called problem adolescents are created by the parental behavior, and hence we need to address this. And we have to always be careful that we don't alienate the parents by making them feel that we are accusing them, blaming them, castigating them, because they are the ones who are going to get the adolescent. And if we do not have a positive relationship with the parents, they will not allow the child to continue sessions with us, nor will they come themselves. So it's an art to make them realize to change their behavior pattern. At the same time, keep a positive relationship with the parents. So this was a case around July 20. I got a request for appointment for teleconsultation. I've done more than 400-500 teleconsultations in the last 3-4 years, especially during COVID. So this worried mother found her son, who was soon to complete 18 years, smoking and drinking often in his bedroom. The father was extremely strict and she was worried about the repercussion, so she had not told the father. During my session with the son, he said his father took 2-3 pegs of whiskey and smoked every day, and he justified that the business is going down due to COVID. It gives him relief and makes him things better. Now, Anand was also stressed out during the lockdown and very worried about his entrance exam. And so he role modeled. He stole the keys to the bar, whether his father kept the drinks, and he started drinking and smoking. He felt very good, and now he indulges in very often. So what was the issues here? Typical bad role modeling of a parent, indulging in harmful ways with stress, nature and nurture. So it was a genetic predisposition. We all know that some people do have this alcoholic gene, which is in the family. And especially when the bar is there in a house and there's an axis which the child has with his amygdala and his hypothalamic limbic axis, they are bound to experiment. And hence you have to be very careful to have the alcohol available to children in your house. So the father had such a huge stock that he was not even aware that the son was pilfering. And I've had sons who take the father's stock and then put water in it. So the father doesn't realize unless he starts understanding, why is my whiskey sounding so dilute or tasting so dilute? Fortunately, mother could persuade father to come for a joint parental session. Very often, only mothers come and fathers rarely come for counseling because they don't believe in the counseling. I could then persuade the father that he himself needs to learn healthy ways of stress management. And during COVID, if they could do family activities, which could relax everyone, this would be a healthy way of stress relief. And fortunately, they did, and this child came out. But most important, I had to convince this 18-year-old boy who's now going to be soon 18, that drinking and smoking will have an adverse effect on his developing brain and could lead to long-time addiction. And he should not follow his father in this respect, because though it is harmful to his father, it is even more harmful to him. In 2020, I got a case, a 15-year-old boy who was not able to sleep. The parents were extremely affluent in an elite area of Pune and a very affluent school. When I asked for detailed HETS history, they were not much interested. They said, please just give us some prescription so that the boy sleeps and he doesn't trouble us at night. So I said, unless I know the whole history, and the background and what the teen needs, I don't hand out sleep prescriptions. This story, unlike the first case scenario of cooperative parents, was just the opposite, and it left me also stunned. This 15-year-old son was a regular pub goer, which was okay with parents, had 3-4 drinks regularly with a group of friends, and on a weekend would have even as many as 8 drinks, what we call as toxic drinking, alcoholic intoxication. When I tried to tell him about adverse effects on teenage drinking, he said he's well aware, ma'am, I'm not addicted. I only drink on weekends in the pub, and though I have a bar at home, I never touch alcohol during the weekdays. So I'm totally in control about my drinking. He also told me proudly he doesn't take drugs and he only binges on weekends because parties are no fun without alcohol. He can still hold his drinks, drive back at home on his own car, comes home about 2:30, 3 a.m. and the parents are okay with it. So this was underage driving, underage drinking, driving under influence on alcohol, and all permitted by parents. When I asked him since when has he got problems with sleep, he very nonchalantly told me this was a post-car accident 2 weeks ago. So though he had his own Ciaz, that night he took his father's Mercedes without permission, drove late at 2 a.m. after the pub, dashed against the divider and totaled the car. Parents were not much affected, they had full insurance. The boy was with him, was related to a high-level person, and everything was sorted out as there was no injury to any human being. And the family were happy that he or other person were not injured and they were not going to face legal trouble. Since then, he's getting nightmares and cannot sleep. I talked to his parents and explained to them all the harmful effects of allowing underage drinking driving. They were not much concerned. They said all his friends are doing. They said we also have drinking since school age and it has not harmed us in any way. And they said car accidents happen and as long as nobody is injured, they're okay and they're moving past it. Please manage his sleep problem. See that he sleeps well. When I explained that this could be acute PTSD symptoms of the accident and he needs more evaluation and medicine, he says he's a tough boy. He'll get over it. We are not going to send him to a psychiatrist. So I told them I don't prescribe sleeping pills. The boy also needs regular monitoring. And I have given up clinical practice and prescription of medications. And I would give you a psychiatric colleague who will decide and give you the prescription of sleeping pills or whatever drugs are needed. Spoke to my psychiatric colleague, wished him luck to manage this case. And then COVID shutdown came. I'm not seeing this patient. So what is the take-home message? Even as a senior consultant and counselor, some cases are beyond our control and we must learn when to let go. Because unless we have parental help, these children are not going to really work. Now I'm coming to some cases of internet addiction. And all of us know that during COVID, internet was the only way to connect. And hence not only children, adolescents, so many adults have got addicted to internet. And post-COVID, this pattern is persisting. And in the 4 years of pre-COVID from 2016 to 20, I found that internet addiction is very rare in healthy, normal adolescents or adults. People who are happy with their real life, people who understand the importance of human-to-human connections, do not get addicted to internet. They know when to stop. However, if you're not happy with your real life, you are dissatisfied, you have psychological, psychiatric problems, then you like to go to the real life or virtual avatar where you can portray yourself to be somebody who are not. For example, you're a thin, puny person and you want to be like Salman Khan. That is the avatar you can show in your macho thing. So most of my internet addiction patients have come from dysfunctional families, social factors, where working parents, nuclear parents, isolation bungalows, housing society culture, staying away in hostels, dysfunctional families of marital discord, divorce, domestic violence, emotional verbal time, no family time, parental addictions, psychological issues. We all know that there's a thrill-seeking personality. And when a person has emotional trauma, naturally he wants to soothe himself. And internet addiction gives the dopamine release and it gives instant pleasure. And that is why these children who are unhappy in life are going to get internet addicted because that gives them instant happiness, instant dopamine, and we have to teach them to go not for pleasure but for happiness. And happiness comes with serotonin, with oxytocin, and the things which require long-term hard work, and we have to come out of our dopamine addiction. And a lot of psychiatric illnesses also get internet addiction, and hence it is necessary that in our history taking, we find out whether there are flag signs for psychiatric illness and also do the assessment for the same. Now, this was a child who was a 10-year-old single child given a smartphone at 8 years by doctor parents who were very busy in practice and were out the whole day. And since they were earning a lot, they now bought a bungalow, shifted from an apartment complex, and this child had no friends, no company after coming back from school. They also shifted him from Marathi to English medium, and this child was now finding it very difficult to cope up with the academics and the new surroundings, and he was spending all the time continuously on mobile. He had a very strict grandparent and a very indulgent grandmother. He refused to listen to the ayah or the grandparents, and if mobile was not given, he went into tantrums and threats of jumping from the balcony, which was not actually a balcony, but the terrace of the bungalow. In this session, this child had an extremely high IQ, and after I got a rapport, he said, I'm bored. If my parents want me to stop mobile, tell them to do less practice and spend time with me. I'm their only son. And this was such a message, a 10-year-old child saying, I want my parents to spend time with me. I'm doing mobile as an alternative. We also did a suicide risk assessment. And luckily, he told me that jumping is just a threat to the scare to the family, and he has no intention of doing so. I had a lot of sessions with their parents asking what is their priority in life. And they said, ma'am, we are earning so much for what? For his future. And I said, if you don't give him time just now, what is his future going to be? And then I had a lot of sessions with the child to help him with non-screen activities at home and also persuade the parents to put him into outdoor sports. Now here the grandparents are the caregivers because the parents are always out. And since last 5 years, I have been also doing grandparenting sessions. And many of the grandparents will be surprised, are happy to come to me and do regular sessions. And these two grandparents, I gave them positive discipline as they were the main caregivers. And I could make the grandfather understand that so much strictness is counterproductive. And I also could make the grandmother understand that so much indulgence is not in the welfare of their grandchild. Sohan is a 14-year-old 9 months boy brought with deteriorating academic performance, complaints from school about disruptive behavior. And as usual, we all know that the parents said he cannot even study for 15-30 minutes at a time, but can do gaming for hours together. Now we have to make the parents understand that this addiction is a thing which all children are going to enjoy, and studies are very boring. And hence, when we tell parents, if you want your child to study 3 to 6 hours, you can't teach them to study non-stop. You have to see the attention span of the child. Some children have 30 minutes, some 1 hour, some 1.5 hours, and you need to give him a break. And this break for 10 minutes, of course, you have to control, it doesn't go beyond 10 minutes, has to be a dopamine break to motivate him. So 10 minutes of mobile is okay if he studies for the next 1 hour. And this is called positive reward, positive motivation. The family history, extremely busy father, no time for the family, over perfect and controlling mother. The screening showed a very high IQ. Child had ADHD, but fortunately no specific learning disorder. And the diagnosis was accepted both by doctor parents, and we did an intervention. Fortunately, the whole family came for regular sessions, and this child got 96% in ICS. And today, he's a medical student. Mohan is a 16-year-old boy, deteriorating academic performance, complaints from the same case as the earlier one. And this also was a dysfunctional family. This was a second marriage of the mother. He had a very understanding stepfather. He had a very good rapport with the son, But the mother did not allow the stepfather to have an opinion to help to the child. And there was a tremendous sibling rivalry with his younger brother. This child showed not only ADHD, but he also had learning difficulty. The child and stepfather very cooperative, came for sessions, but mother refused to accept the diagnosis. She said, child is just spoiled and irresponsible, making excuses and needs strict punishment. She came for a few sessions with me and the team for learning for reduction in mobile and gaming addiction and remedial coaching, but dropped out of the few sessions because she wanted instant results. So you can see cases were the same, but because in a family there was parental acceptance of the diagnosis and parental cooperation, this child did very well, whereas here this poor child could not come for follow-up also. There was another child who was 14 years old, and this family was in USA, and this child went into severe internet addiction, and the child parents shifted to Singapore, thinking that the family will be closer to India with a joint family and he will improve. But there were no change even in Singapore. So they shifted now to Pune. By now, this child had gone into absolute morbid pathology of internet addiction and gaming. He refused to come out of the room, gamed the whole day, refused to take bath, forced parents to keep buying junk food, threatened suicide if disturbed. And of course, he obviously refused to come with the parents to see me. Clearly, a case requiring psychiatric therapy, but the parents were just not willing to accept a psychiatric evaluation. And of course, this case dropped out. So again, if the parents are not willing to accept that something is seriously wrong, we cannot really help the child. Another child was a parent who was in CRPF. Father died 3 years ago. Mother got a job in Mumbai. Family in Pune, mother away on job. She came to help for her 20-year-old son, as she had heard about some successful cases from her neighbors. Son was staying with the grandmother and younger sister till he was 16 years old. Then he said, I'm a big man now, and insisted on separating a separate room. The mother accepted that she indulged every wish of him since childhood to keep him happy. So this child started smoking at 12 years, drinking at 14 years, internet addiction at 16 years. And what was the present status? Last 2 years, he was staying in a kholi, and the grandmother supplied a tiffin every day. He interacted only with the mother on the phone, gaming, drinking, smoking, alone with 2 exclusive friends who were parasites living on his money and food. So obviously you can see there were flag signs of abnormal behavior since childhood. I could persuade this mother that the son needs psychiatric assessment for multiple addictions and ruling out psychiatric disorders. I could arrange a senior psychiatrist to do a home visit since the boy refused to come to me or the psychiatrist. And this was diagnosed as a paranoid schizophrenia with multiple addictions. We got him admitted for rehabilitation. He's under therapy and he's as stable as can be with all these multiple comorbidities. Now I come to a very, very common issue which we all are facing as sexuality issues in the adolescents. So this was a very interesting case. Then I just joined Jahangir Hospital and has to get a lot of obesity patients for behavioral management and healthy weight loss. So this was a child who was referred by an endocrinologist for assessing and managing change of behavior. This was a very conservative religious Tamil family, and last 3 to 4 months, there was sudden deterioration in study. The child was not mixing with peers. He was keeping his room locked all the time, spending a lot of time in the bathroom. He was very close to his mother and very communicative. He used to hug her many times a day. He used to do regular puja with her, but now he stopped all this. So I found out from the mother that he can answer any questions or problems. Now, normally we don't do direct questioning, but I could understand with all my thing that maybe this child is doing masturbation and that's why he's feeling guilty. So I asked him that whatever you tell me will be in confidence and I will not tell anybody. He said, for example, what? So I asked him, for example, 1 minute, I'm just having some. Yeah. So I asked him that what questions will he said? I said that, at your age, sometimes when you touch yourself somewhere, you may get pleasure and you may start doing that action and you may feel guilt. Is this what is happening to you? The moment I asked this, he poured out his anguish about masturbation. And he said, yes, he is regularly doing it. He's got addicted to it. He was not hugging his mother as he felt he was dirty and she was pure. He was depressed so that he did not enjoy studies, and except masturbation, he was not enjoying anything else. He stopped puja because he felt he was a sinner and he felt God is not helping me. But it was very interesting that most children would say, don't tell my mother. But this boy wanted to tell his mother because he was very, very close to his mother. And he was ashamed and upset that he told her everything and why he's hiding this. So normally, as I said, we don't want the parents to know all this. But in this child, I said, okay, do you want me to explain to your mother? He said, yes, please, I will be very relieved. So when I called the mother and told her, normally I'd take separate sessions, but here the child and mother were distressed. So I prolonged the session and then called the mother inside. Normally I take the first session with parents, second with adolescent, and a third session with both of them, where I tell them my plan of action. When I told her this, she was horrified and she started crying that why is my son doing a perverse action? I have failed as a mother. So first I had to calm her down, explain how normal this was, and I explained how important it is for her son to get maternal acceptance. And once his guilt goes away, he will settle down to normal life again. Fortunately, mother accepted that she will tell her son that she has been explained about masturbation and it's okay, and she'll hug him in my presence. So I called the son back in. The maternal acceptance and hug. He broke down, cried in relief, and told her all his feelings. And then the smiles on both their faces was a reward which I cherish. Did many more sessions with him to reduce his frequency of masturbation, brought him out of his depression, gave him healthy weight loss, and he started doing well in academics again. So we all need to understand as adults and experts that during puberty, a simple physiological process can lead to a lot of anxiety and can cause depression if a boy can't stop and enjoys doing it. Affects all aspects of his life, self-esteem, personality, academics, relationship with peers, and sudden change of, so what is we have to understand? Lessons. Sudden change in behavior and personality are flag signs of mental illness, sexual, physical abuse, substance abuse, but also could be as simple as physiological issues. And lessons learned is, in addition to all this, develop a rapport. And if you feel that there's a guilt of masturbation, it is okay to ask him or her directly, because girls also have the same guilt. I have dealt with a variety of cases. Now, this is a very interesting case. This is my first case of pornography. In 1991, I started my first weekly adolescent clinic in Bombay Hospital. I got a distress phone call from my close friend who was crying, said, I want urgent appointment. And I said, I can't talk on the phone. In my clinic, she said, while clearing her son's room, she found porn magazines under the mattress. And she was more embarrassed because the maid also saw it. Remember, this was 30 years ago. There is no digital media. Porn was not universal. It was not acceptable action. It was considered perverse. And seeing those magazine pictures was a cultural shock to me also. Since she was my friend and her son was my patient, I managed to calm her down and said, don't worry, nothing serious. We can handle it. I read up a lot, consulted my psychiatric colleague, my team of psychologists and counselors, managed to counsel the mother and son, and successfully managed to counsel the maid also, so she doesn't go and spread it in the apartment houses and spoils the name of this boy and the family. Subsequently, we all know today porn has become like universal, and there's no point telling children or adolescents this is immoral and this is perverse. What we have to teach them that what are the adverse effects of porn addiction if it happens in their childhood or adolescent age, explaining that it diverts them from studies and now their career is their focus, and its diversion will affect their academics and their future life. We also have to explain that if they are seeing abnormal pictures of sexual activity, bestiality, this is going to distort their sexuality images, and they may not be able to have normal marital relations with a normal, healthy woman once they're used to all sorts of variations. And this is what we need to tell them. And I've been doing this for a lot of porn addiction cases which are brought to me by adults, that is young adults themselves, or by parents for the young adolescents. Now we think of all this in elite and middle socioeconomic group who have got internet addiction. In Sassoon Hospital, where I was a professor in 1989-91, 20 years later, I joined in 2020 as a visiting consultant. And we trained the entire pediatric department into adolescent medicine, and we started a weekly adolescent OPD. And then I started seeing a lot of children from the slum areas and the poor areas of Pune. So this was a child which came in our OPD. The mother brought the child that he was misbehaving with his 10-year-old sister, sleeping on her and doing inappropriate action. Now this boy had been befriended by a gang of older brothers, older boys, taken to the terrace, shown porn films, made to do certain acts for the boys, and he was earning money. So he used to get stimulated and at night tried to experiment with his sister. So obviously, we did a lot of sessions with the son, with the sister, with the family. And of course, we took the help of the Sassoon Hospital Psychiatry Department, Mental Health, and we found that he's making progress. However, COVID shut down. I stopped going to Sassoon, and the OPDs also were not working. So this child was lost for follow-up. But I hope he's doing well. Now, there was one case which I would like to share of gender dysphoria. A senior gender dysphoria again requires extremely careful handling, multi-speciality intervention, and we as pediatricians or adolescent experts need to be trained how to handle gender dysphoria. And I've done a lot of courses on this, and Dr. Anaghai Jaikar, who was a close friend of mine and a former HOD of Nair Hospital, who's now settled in Australia, has helped me to handle a lot of cases of gender dysphoria with online sessions on Zoom with parents and the child. A senior pediatrician from Nagpur was managing a male child from birth to 16 years of age who showed signs of dysphoria. He would be discussing with this case with me off and on. He was from a very rich Marwadi family, third child after two sisters. The father was grooming him to take over the business empire. The mother was aware of his feelings that he was a girl trapped in a boy's body. Tried to tell the father, who had a violent reaction. Thereafter, both son and mother did not dare to raise this topic with the father again. When the boy became 16 plus, he shifted to a Pune college. So I took over this case for management. He was quite sure. Founder Center in Bangkok, which was not scrupulous about, ready to start and the reconstructive surgery. He had a lot of personal money and finances was not an issue. It took him, can you hear me or it is unstable? Can you hear me or unstable?
Yes, ma'am, we are hearing you.
Okay. So it took me a lot of effort to counsel him to wait till he was 18 to 21 to start the hormonal therapy. I also persuaded him to do a psychiatric evaluation, and there's a very fixed protocol for gender dysphoria, which is well known and international guidelines are there, and it is stepwise before this surgery is taken. I called the parents to Pune for many sessions. The mother was on board for a long time, The father just could not accept this initially, but after a lot of effort, accepted the son's decision. But unfortunately, he cut him off from his life. And I hope sooner or later, we have seen the movie of gender dysphoria, and the father hopefully should accept him. Hopefully, he'll accept this beautiful girl, difficult since he already had 2 girls and this was a boy for him. This is another case sexuality where we talk of neurodevelopmental disorders, especially challenged children. I have a doctor friend who had an autistic son, 20-year-old. She had trained him to express his feelings and love and happiness by giving her a hug, a rose, or a picture of rose and say, I love you. He was a handsome man with a child's mind. One day, there was a complaint from a neighbor who was going to lodge an FIR, and the mother gave me a call to come ASAP. Their neighbor had a 13-year-old child. This boy liked her. They used to talk off and on. Both the families were friends. That morning, he gave her a hug, told her, I love you, and gave her a rose. You can imagine the father's reactions. And he was absolutely angry. I had a long talk with the neighbor, explained to him the scenario, explained what autism means, explained that the boy was really innocent and did not mean any sexual molestation or harassment. He requested him to withdraw the FIR. He fortunately did. I showed him the boy would not repeat such behavior after training and counseling by me. And I did a lot of sessions to explain to him how he should behave with a girl and also a boy. That is the boundaries of dealing with the opposite girl sex or the same sex. Do's and don'ts of what to say, what not to say. Told him not to touch anybody. Taught him physical boundaries. Took a big doll. Showed him what he will be considered as good touch and bad touch by showing him all body parts. Still take sessions with him to reinforce the behavior. And I really feel sad about the situation of neurodevelopmentally challenged children, where sexuality education is rarely given to them because the parents are so focused on dealing with the morbidities, the comorbidities of neurodevelopment problems, that they forget that this boy or girl is a normal adolescent in sexuality. And unless we help him with his special sexuality issues, they are going to have a lot of challenges in society. And I normally take for specially challenged children's parents how to deal with the sexuality issues of their children and adolescents. Okay, so I think I've finished now. Hello.
Madam, if allowed by the event manager, I have few questions for you.
Sure.
Basically, what is the protocol of record keeping in your office practice?
So what I do is,
like in some cases, you said you lost the follow-up and the cases were very delicate as per your opinion. But then as a pediatrician, as a practitioner, as a counselor, what type of records do you preserve so that if there is some mishap like suicide or poisoning or whatever?
See, I understood your question. Now, Atul, I have come to a stage where I'm not doing routine regular practice. I am doing complex referral cases which are referred to me by my students and my junior colleagues. So most of the record keeping is done by the primary person who is sending me the case. And I am keeping record only of the session which I am doing. And as I said, I am doing more of instructional counseling and sessions. So I refer the patient back to them. So most of the record keeping is done by them. When
so
I do
how in your setup you are preserving the records that you have told this? Yeah.
Yes. So I have a file which I make my notes, and this file is kept in my cupboard. And when I said these cases were lost for follow-up, Atul, they were mainly because of the COVID period. And none of my other cases are lost for follow-up because some of these cases have also shifted out of Pune. So this is a thing, and these lost for follow-up are not because they didn't come back to me, because some of the cases I felt should go back to the primary counselor who is going to spend more time on them. So this Zoom video which I do, I take permission of the patient that I'm recording your sessions because
that is what I wanted to know.
yes, and I have a special hard disk where I keep this, and it is not also on my laptop, and this hard disk is kept separately in my cupboard. So this is kept with patient confidentiality. So I have kept these Zoom records, and I've also kept the files.
Okay, great. Second thing is, you had some few cases of masturbation problems. So, what is your latest data about masturbation percentage in boys and girls?
See, I've not done a data collection on masturbation as a research project, so I won't be able to give you the statistics.
Because
But I think-
there was this movie, madam. Oh my God!
Yes, I remember that.
God,
Excellent movie. Excellent
There
movie.
the statistics of masturbation in females is too high, 76%.
But why shouldn't we? I mean, females are
I
now
don't mind even
emancipated.
110%, no problem. Go ahead. But the thing is, previously we were saying 40%. Now it is 76%. So,
See, Atul, it's like, when we say cancer cases have become high, it is both the detection as well as awareness. So before, masturbation was not even accepted. It was guilt. People would not even express it. So whether it's really gone high or people are more open to accepting it, then there's awareness.
And consider it as a normal process.
Yeah. Atul, there are some chat questions coming. Can we take those?
Yeah, absolutely. I'm asking you my own chat questions, madam.
Your questions or other people's questions?
No, my questions only.
And anyway, there are other people also who are asking in the chat. Can
let them. Please go ahead.
1 minute. Let me see the chat. Can somebody, Reena, can you go to the
Chitra
chat and
asked,
ask me questions?
Yes, ma'am. Yes, ma'am. Chitra ma'am has asked, respected Swati ma'am, enlighten us on key questions how to ask the adolescent about sexual behavior.
Okay. Now, one thing, remember, we all have the POXO Act. And any sexual behavior below the age of 18, even if consensual, is considered rape and has to be reported. So below the age of 18, be extremely careful about asking sexual history. I am now dealing with a lot of young adults. So the young adults who are 18 to 30, I have no issues at all asking about sexual history very directly. What to do about children below 18, frankly, is a question which we are dealing with. And a lot of new recommendations have come where NGOs and, even the, I forgot the exact thing, NMC and all are trying to make below 18 consensual sex between two 16-year-old children or 17-year-old children decriminalized. And I hope that comes soon. And when that comes, we'll be very, very happy to ask this. Till then, it's a very tricky question and it will go case by case and we'll have to deal with it issue by issue.
Right, ma'am. Right, ma'am. Dr. Pooja Bharti ma'am is asking, ma'am, please share the few tips on how to educate adolescents about healthy sexual behavior.
Madam, you are paused.
Ma'am.
Madam, you are paused. Swati Bhave, madam, you are paused.
I'm paused.
Yeah, now it's okay. Yeah.
Okay. If the internet connection is unstable, I can go to another one.
No, it's okay. Now you are audible and visible also.
Ma'am.
Yeah.
Can I repeat the question?
Please.
Oh, okay. Dr. Pooja Bharti ma'am is asking, ma'am, please share few tips on how to educate adolescents about healthy sexual behavior.
Healthy sexual behavior. Okay. So as you know, I run an NGO called AKI, Adolescent Association of Adolescent and Childcare in India. And many IIP members, AHA members are part of my organization. So we regularly conduct workshops in schools and colleges for parents, teachers, and adolescents themselves, where we first talk of the concept of the importance of having boys and girls friendship. And we say it's very necessary for your personal emotional growth to have the both sexes getting their views. And then we talk of what is healthy boy-girl friendship. And these healthy boy-girl friendships, when they understand, we teach them what are the boundaries which they should keep. And these boundaries, frankly, depend upon the culture. For example, if a person is come from a very elite and a very hi-fi society, hugging is considered normal. But if you come from a middle class, little conservative society, nobody is going to like their boy or girl hugging other girls and boys. So it's very culturally sensitive. It also depends on how educated or how open that family is about the same and the opposite sexes mixing. So individual counseling is one-to-one, which is very specific, depending on the child, his family, and his environment. But when we do group counseling in these workshops, we teach them what is toxic relationships. That means we tell them that if you have a controlling, abusive partner, this is not a healthy relationship, and how to come out and understand a toxic relationship. We also explain that when you have a relationship which is not into physical intimacy, even if you break off, it is more easy to cope up with that breakup. But if you go into a physical intimacy, then it's a very deep relationship. And not only it is not easy to break up these physical relationship later, but when you get married, if you have had 3, 4, 5 physical relationship, it is likely that it may affect your marital relationship. So again, we never tell them what to do. We don't say having 4, 5 physical relationship is immoral, it's a sin. We just explain to them what is the positive effect of a healthy boy-girl relationship, what is the advantage of going slow and not going into sexual intimacy before you are sure of your partner, and how not having multiple partners before marriage can be adversely affecting it. We also talk of, healthy just hugging and being together for oxytocin release as compared to a actual going to bed together or sexual intimacy. And of course, we have to talk of safe sex to prevent teenage pregnancy, sexual transmitted disease, etc.
Okay. Chitra ma'am is again asking, do we have to share this relationship with the
If the patient
caretaker, ma'am?
if the child is below 18, 100% no, because the child is an adult. And that is what I tell you, that whenever I get these parents with relationship, I have to tell them that whatever your child tells me about the relationship will remain confidential. And if I feel something has to be told to you, I will take your permission to tell the parents. For example, if a child or an adolescent is going through a toxic relationship and that person is blackmailing her or him, if that child is not able to come out of that relationship, then I explain to the adolescent, you need parental help. If there's a cyber crime, if there's a cyber bullying, I tell them you need parental help. And I convince the adolescent that you must tell the parents. And if you're afraid to tell yourself, I will do that job. And very often, after having told the parents, calm them down, I bring the parent and the adolescent together. And then together I do sessions for the child to manage these problems.
Okay.
Thank you.
अमोल सर, मी माझा प्रश्न विचारू का, इफ यू परमिट?
सर एक प्रश्न घेऊन घेऊ डॉक्टर चंद्रकांत सुरोसे सरांचा, मग तुमचा.
प्लीज प्लीज प्लीज, मोठे साहेबांचा आहे.
Ma'am, senior pediatrician Dr. Chandrakant Surose from Nashik IIT, he is asking, a 10th standard male brought by parents as they were worried about his change in behavior. So his question is that, is the consent required for getting history of sensuality? How to approach?
See, again, as I said, is a 10th standard boy, maybe 16-year-old. So again, the same POXO law and we have to do. And we have to go very slow on this. Never take sexuality in the first session. Like even I say that when you're doing Tanner's charting, don't do it in the first session, because adolescents are very embarrassed to open up their body in front of strangers. So Tanner's staging or sexuality should come in the 3rd or 4th session. First, build up a rapport, build up all his heads, everything except sexuality. Get his academics on board, take his emotions on board, take his lifestyle on board, see that he follows a healthy lifestyle, sleep pattern, good eating, and or mobile addiction, and then go to sexuality. And frankly, sexuality is a very sensitive subject, and I would advise that if you're not trained, take help of a senior person who is more used to handling this. And I get a lot of reference from my students and my junior colleagues who are handling everything else, but they need my help for this sexuality, and I return the patients back to them for follow.
Okay, thank you, ma'am. Atul is helping us very regularly for this.
Good.
Okay, sir. Yes. Atul sir, please.
Yeah, can I, madam? One last session, one last question. Now that you mentioned about Anaga Jayakar, madam, who was my lecturer and associate professor at Nair Hospital also. I have been suggested by Kalatkar sir, you and all of us on the screen right now that we should continue with this session. So, if she is doing a lot of work on gender dysphoria or GID, gender identity disorder, so I would suggest that can we have her or many experts like her on screen at their convenience to enlighten us about these issues which are hardly touched upon.
I am planned a AKI training module on gender dysphoria in February. I would love to have AKI collaborate with Maha-AP, AHA Nasik, and do a joint program.
Okay, that is something very fabulous, so that you are also here physically in February.
Yeah.
So we can let Nasik AHA and Maha-AP decide about it. So the ball is in your court, Amol Pawar sir.
Yes, sir. 100% definitely will do, sir.
Yeah. Great. So it was a very fruitful meeting. Let Dr. Sulbha Pawar madam offer the vote of thanks.
Dr. Sulbha.
She was supposed to. Otherwise, you are her. I won't call you better half, but you are her half, whatever.
Sure.
Wife is always better half.
She's
Sulbha madam
there.
आहेत sir. आहेत sir.
She is there. Yeah. Your voice is
Ma'am,
not
आवाज
audible.
नाही येते. Sulbha ma'am आवाज नाही येते.
Sulbha madam, you are not audible at all.
Sir, आता येतोय?
Now it is
Yes.
little better.
Thank you so much, Dr. Swati Bhave, madam, the legendary adolescent pediatrician from Pune. मॅम, एवढी व्हरायटी ऑफ केसेस एका दिवसामध्ये शिकायला मिळणं म्हणजे आमच्यासारख्या ज्युनियरसाठी डोक्यावरून पाणी जाण्यासारखं आहे. पण जेवढ्या चांगल्या पद्धतीने तुम्ही सांगितलंय की आम्हाला एक दिशा मिळाली की आज आम्ही कसं इथून पुढे कंडक्ट करावे सेशन्स. मला फक्त एक छोटासा प्रश्न विचारायचा आहे, विचारू का मॅम?
मॅडम, हिंदी किंवा इंग्लिश मध्ये विचारा. देयर आर सो मेनी नॉन महाराष्ट्रियन्स ऑन द स्क्रीन.
Yes, obviously the question will be in English only. I just want to know that some parents are there. Some of them are my patients' parents actually. They are asking if they are engineers or they are doctors or they are bankers, but they want that their kids should go for a medical or engineering field only. And the kids are not at all listening to them. They are telling that till now we are not decided our direction, or they will tell that we are not seeing anything good in your field, whichever you are telling. So how we have to guide them and direct them for the correct field for them in their life?
See, first thing we have to make parents understand that your children are not born to fulfill your ambitions, and you know that they have to have their own path. So if they like your profession, then for example, both my sons wanted to become doctors when I was a full-timer, because they saw I had Christmas vacations, May vacations, and then I joined Bombay Hospital as a practitioner. And when they saw the emergencies, the night calls, etc., they both said, we don't want to become doctors. And we are a family of doctors, as you know, but they said, we don't want to become doctors. Can we just skip biology? We just don't want to take it. And we accepted it because they didn't want to become IS like my husband or doctor like me, and they both became software engineers. So parents have to understand that if the child likes the profession which the father or mother have taken, they will automatically go. For example, my father was a role model for doctor. And at the age of 3 years, I said, I'm going to be a doctor like my father, which I continued for many years. So parents have to understand that whatever they want, if the child fulfills it, that's fine. But if the child wants to have his own path, rather than forcing him into NEET or IIT and JEE, help him to find out that path. And I have done this for many children and adults over the last 40 years, and I have been successful. I can also take a workshop if you want, how to make parents understand that the choice of the career which their child takes has to be accepted.
My children will gladly accept this workshop, madam. Okay, Sulba madam, please continue.
Some parents are eager to know that how can they mold their children's decision to take the career which the parent want. Is there
That's
any way,
exactly
ma'am?
what I'm saying. That is manipulation.
Actually,
yeah.
here I hate to interrupt, but madam takes excellent session on effective communication with children. So I think if we continue with the program, I want Swati Bhave madam, please, we want to learn effective communication, how to communicate with children. You are an expert in parenting yourself and now grandparenting also.
Yeah, I do
Yeah.
know a lot of grandparenting sessions.
Yeah. So I think that will be very useful to all of us, so that the same skills we can employ in our private practice also. When we
Another
talk.
thing which I can do is we regularly conduct Aki programs, and we'll start putting our links on the MahaIP group. And wherever you want MahaIP or AHA, you can be in coordinate with us. So instead of duplicating programs, let us work in synergy and let us do these programs together.
Okay.
Right, ma'am.
These are all policy matters up to Pawar couple, so I'm nowhere in the picture. Please conclude with the Thanksgiving session, madam.
Yes, sir, but I'm going to trouble ma'am again. One more question from one of my friends actually.
Yeah.
They were telling me there are some children in their OPDs that they pretend to be there in some kind of some stress or depression when they are inside the house or when they are in the society. But when they go out in the schools or when they attend the meetings, parties or their classes outside, they're very much talkative and very much social. So how we can judge them, these kind of children actually?
See, these are two things. One is understand that adolescent depression is very different from adult depression. They put a mask and an image to appear very happy-go-lucky, where inside they're really troubled. And in fact, their depression may come out more as aggression, anger, fighting with parents. And hence, when we tell your child is depressed, they say, kind of nonsense. He is fighting with us, he's doing, and then they do a lot of internet addiction. They're constantly watching TV, they're constantly gaming. So parents don't realize what is depression. So what is happening, it may be really a real depression. And if the home surrounding or the atmosphere is such that the child feels depressed, he's going to look different. And when he goes out, when he's meeting his peers, when he's doing his activity, that is dopamine stimulation. So yes, temporarily, he's going to look very happy. Also, I've got a lot of cases which adolescents are master manipulators. So they are quite happy outside, but they want to show their parents that they're very unhappy and sad. So the parents give them more attention. This could be a cry for help. Attention seeking because they are not getting enough parental time, or also manipulating parents, like if the child looks sad, then mobile de mala, if the child do, then motivation. So there's a lot of issues involved. How much is real depression and how much is manipulation?
There is also one simple delicate issue of safety at home and the premises around the home, which may not be true for, especially for girls. So that also should be considered in these types of children. That is what I feel, if I am allowed. So, okay, Sulba madam, continue.
Thank you to everyone who
Voice.
attended the program today. If anyone want to ask any question, we are having more 5 minutes for that. Otherwise, I'm going to conclude the session today.
I think this is good enough. It's enough of information for the day and the entire weekend. So I think please say whatever you want to say. That's all.
Yes, yes, sir. We as an Nashik AHA team want to thank the Maharashtra IAP they have given us this opportunity to conduct these kind of programs with under the able guidance of Dr. Atul Kanikar sir. We are really very much thankful to Dr. Ramakant Patil sir, Dr. Amol Pawar, and our coming president-elect, Dr. Khalatkar sir. I'm thankful to Swati Bhave madam for giving us till the session. We're having the highest attendance till date. And I'm very much thankful to this conducting team also, as well as the technical team, and for Pallavi madam also. If anyone wants to say anything, the forum is open. Otherwise, we are going to conclude this session now.
There's a question on sibling rivalry. Again,
Yes.
this requires handling of the parents, and what parents should not do, what is known as differential parenting. That means showing more love to one child as compared to the other, constantly comparing. And what happens, most parents compare because they think it motivates. So they compare their son or daughter with the other child, neighbor's child, relative's children, and they think this motivates. This doesn't motivate, it demoralizes. So each child is unique. And if you put the strength of each child and not compare them with each other, 90% of sibling rivalry is generated by parents, by their handling of the child and showing favoritism. Now, it can happen that between two children, you may love child one more than the other. And why does this happen? Because the personality matches. For example, if I'm a very calm person and my son is aggressive, then I prefer the other calm person, and vice versa. Or if I'm a sportsman, the father is very macho and he has two sons, he will prefer the macho son compared to the little less son. But whatever it is, you cannot show it to the children. The children have to always feel my parents love both of us equally. Okay, shall we end now?
Yes. No, I think there are no any more questions now.
Actually, my chicken is getting cold. It's a Sunday afternoon. So.
Thank you, Swati ma'am. Thank you, Atul sir, and all.
Yes. धन्यवाद. आपण परत भेटूया next
Ma'am,
Sunday.
but
Next January 1st Sunday. I think we have excellent speakers from Nasik also who have contributed to our IIP textbook of adolescent medicine. And I think Ramakant Patil and Shyam Chaudhary have contributed for sports medicine. Even Bhave madam knows a lot about sports medicine.
Yeah, written a book on handbook of sports medicine because my husband, me was sports specialist and my son was national TT player.
Yeah, so I think we have a good team here and we can conduct this program provided there is some Zoom support for all of us. So we call it a day. And Sulba madam, please conclude now.
I have conducted 2 Thanksgiving sessions till now in this session. We will have more new question every time. But now I really
we would love you, all of you, to join our Nasik AdolesCon 2024. And then next month's meeting, we will formulate Rina Rathi madam, Sulba madam, Amol Pawar sir, and we will all sit together and decide what to do about the future meetings. But there are so many topics remaining. It's not going to be over. Adolescent medicine is not going to be over in 11 sessions. So there are so many topics. Every month we have a new issue coming up. So let us join hands and work together continuously till the topic is over. Okay. So thank you so much, and thank you very much, madam, for your precious presence. As always, you are fantastic. Thank you. Yeah.